Assalamu alaikum. Bismillah wa salatu ala rasulillah. So thank you everyone for joining me in this PowerPoint in my grand round. This is my name is Mahdi. I'm Dr. Mahdi. I'm one of the general pediatric consultants at the CTU, and inshallah it's going to be I'm hoping to introduce you to a good lecture inshallah on PowerPoint about the heads up, the art of teen screening. Okay, let's go. Bismillah. So my objective in this PowerPoint is to understand the importance of the psychosocial screening, be able as a pediatrician to screen for risk behavioral in adolescent. They have a lot of risk behaviors in that age. Become more proficient in the use of heads interviews. So I'm hoping inshallah by the end of this PowerPoint slide, at least you have an idea what the heads assessment is, how to screen for a psychosocial history, and to be more practical in using it. Before I go to the adolescence and heads assessment, the reason why I choose this topic, honestly, since the last year I came here, never see one psychosocial history in adolescent patients. And I know that our limit in the age is up to 14 years of age. However, I'm sure you a lot of guys saw a lot of teenagers, 12 years of age, 13 years of age, so they have different issues in their life, which is, I think it's expected. And nobody mentioned it, nobody talk about it. And I think that was a big mess for them. So this is why when I was assigned to do the grand round, I was thinking about something, at least at the end of this presentation, if we know that this is this very important thing, this can help and save a lot of teens' life. So this is why I choose this topic. To go with my slide, of course, everyone has kids, and all of us went through this, I would say, difficult stage in our life, the adolescent stage. So basically, it's a transitional period between the dependence of the childhood and the independence of the adult. It's a very clear definition, and I think this is why most of the teens, when you see them, they are confused. They don't know what to do. They ask for help, but they can't ask clearly. This is why we need to offer help for them. So why adolescent is a very tough and very difficult time in life. They have a lot of to-do lists, so many things to do. First of all, they are they transitioning from the childhood to develop an adult body. They attain the sexual maturity, the secondary sexual characteristic in male and female. And by definition, anything beyond 9 years of age of secondary sexual characteristics considered normal. It's not a precocious puberty. So this is
this one you can see here, doctor. The video is not
okay. I need to mute. Okay. Acquire mature thinking and planning. This is why it's a very critical stage in their life, and it's their time to develop their own identity away from their parents, away from whatever the dad and mom asking them to. So they have their own life. Okay, so if we want to let's say sum it up in one slide about what's the youth and what's the teens having problems. Basically, I will say there's a lot of problems in their life, starting from the least problematic is the family, the supportive members. However, nowadays with the media, social media and the internet, there's a lot of pressure. There are a lot of access to that place. So that causes a lot of anxiety to this kind of patient. And since they don't have the maturity to differentiate between what's bad and what's right, sometimes they might go in the wrong direction. Of course, we're talking about the peers as a very important aspect in their life. one study showed that teens from age of 16 to the age of 18, they are influenced by their teen friends around 80%. So it's a very important a very important task in their life. Community, of course, is a very important place. School, where the teenagers, where the adolescent people spend more than half of their day at school. So this is why we need to make sure that they got all the resources in school, community, and of course through social media. Okay. Going back to the psychosocial screening, why it's important, why I mentioned it in my grand round, why I think it's very important to screen for teenagers. So basically, you obtain information about the health risk behavior. I keep mentioning about the health risk behaviors. Whoever understands or not, I'm going to explain it more. It's more for people who get more drugs, and they don't have, especially the narcotics, is a very critical task. So this is one of the risk behaviors. The other thing is riding a car with someone who's not licensed, and they might get in a motor vehicle accident. This is one of the risk behaviors. So it's a very common at this age. Assess for safety. That's the most important thing that we get from this whole presentation. Is this patient, is this teen is safe or safe at home, safe at school, safe with his family? That's the most important point that I need you guys to get from this my PowerPoint presentation. So there's going to be a good opportunity for counseling and guiding the teen, and provide different resources to help them in their life. And of course, you're going to build a good trust with the teenager patient, with the adolescent patient, which is the most difficult thing to do. One of the things that you guys, as a pediatrician, is to talk to adolescent patient and then gain their trust. This is a very difficult task, but however, with practicing, with getting more knowledge, I think that's going to be a good start from today. So, as I mentioned, the adolescent patient, they are, I won't say fragile, they are very vulnerable to external stimulation, friends, social media, and school. So this is why we need to be very careful when we're talking to them, dealing with them. A lot of people mentioning this, it's a time of growth, of development. It's not a time to be ill or to get accident while you're doing this risk behavioral things. However, in this age, as I mentioned, the exploration can be very dangerous. They can introduce to someone strange in the social media. They can go out with unknown friends. So, and it's a very, very, very common thing. So this is why we need to make sure that they are in safe place and safe hands. This is one of the things I need to raise it up. The most first cause of death in adolescent patient, it's a motor vehicle accident, which is, I think it's a very well-known thing. However, the second cause, it's the suicide and homicide. This is why you need to know that these teens are very vulnerable to stimulation. They might get anxious, stressed out, and then later on depressed, very easy. So this is, it shows that very important thing that to screen for suicide, depression, one of the psychosocial screening, because this is the second most common cause is that. Okay, so today I'll be more focusing more on HEEADSSS assessment. This is an mnemonics for different stage of things that will be covered in my presentation. It's called HEEADSSS, like heads up. To make it easy. So it was developed by Dr. Berman, 1972. However, Dr. Cohen get the whole credit while he did his fellowship in adolescent medicine at University of California, LA in 1985. He's considered the godfather of the HEEADSSS. However, Dr. Berman developed it, but Dr. Cohen has a big achievement, and he's still He's an assistant professor at UCLA until now at the Department of Pediatrics. This is why it was a very important and achievable project for him to get this HEEADSSS assessment. We can use it successfully in adolescent clinic. Unfortunately, we don't have an adolescent clinic, but we do have a general pediatrics clinic. That's the most important, and that's the most important place to use it. We have a lot of general pediatrics clinic. We have a lot of general pediatric patients who come for vaccination, who come for different issues. Screening for psychosocial history is crucial in this situation. You cover the area of risk behavior. Again, this word, you're going to see it a lot. We see a lot of unpleasant behavior from the teens. Is it bad or is it right? We don't know, but this is part of their hormonal changes. This is part of their body, how it's growing. Usually it's conducted from 15 minutes to 45 minutes. However, the average is going to be 25 minutes. I am very, very, very honest with you. I will not expect anyone to sit with a team for 25 minutes. I think I would say 15 to 20 minutes max. It's very, very important to have at least an initial assessment of this kind of patients. Okay. So HEEADSS, again, H, it's a mnemonics. The H go for home. E, education/employment. We see a lot of teenagers who is study and their employee in different places. E, go for eating, very important task. A, activities, what they do for fun. D is for drugs. We have triple S. The S, the first one is for sexuality. S for suicide and depression. And the last one is to assess safety at home or different places. Okay, I'm going to go through different the different letters, and at the end, inshallah, we'll sum it up and we'll get you more questions. So before we start with the HEEADSSS assessment, as a pediatrician or the general pediatric resident, as a healthcare provider, I would say you need to know when to ask the patient, what's the main idea behind the psychosocial, and how can I introduce myself. So usually when you start to do HEEADSSS assessment, we're expecting the patient to be well. You can't do it in life-threatening situation. Let's say I have a 13 years old who came with a motor vehicle accident, and you're leaving everything and you ask him about what do you do for fun. It's very unpleasant thing. So whenever the patient is well, whenever the patient is feeling well, this is the best time to introduce yourself and talk to him. When you go in the room, there is a patient, you ask the nurse, he said let's say Abdullah is 13 years old. You introduce yourself to Abdullah first. Assalamu alaikum, Abdullah, how are you? Then you talk to the parents. The reason behind that you gain a trust from the adolescent. You're treating him like a big adult guy. So at this is one of the hints that you always tell the pediatrician to introduce yourself, and then you talk to the parents. So when you talk to the parents, I would like to emphasize a very important thing. We are not against the parental guidance or parental control. No, that's not true. I think one of the most important things when you go and introduce yourself is to ask the dad or mom or the parents, if they are both together, about any concern about this patient. That's the most important thing. That's to give you the beginning of your introduction. If do you think this guy has, or this girl, she has any problem while at home? So it's called a parental consent. And you're going to ask, of course, about chief complaint. When you do your HEEADSSS assessment, politely, you ask the parents to leave the room, and you explain to them. I know it's a very difficult situation. I did it a few times before, and I got this few people that are staring at me like in a bad shape, like, what are you going to do to my kids? This is normal, I think, in this culture, which is fine. You need to explain more to the parents that at this age, I need to talk to your daughter's son in a private way. We want to make sure that he's doing fine, and we're just going to talk, chit chat with him, and that's it. It's going to be for 10 to 15 or 15 to 20 minutes. When you go inside and you talk to the patient by himself, you need to emphasize the most important thing in this topic is the confidentiality. confidentiality is a must. It's a top priority, and you can't breach it unless you have a few situations that I will explain it later, inshallah. The most important thing to make sure to gain the trust of the teen is to emphasize the confidentiality. You're gonna tell them all the things that you're gonna mention. Nobody will knows about it. Neither your parents, school teachers, authorities, nobody. This is gonna be between me and you. Okay, that's the most important thing to gain the trust. So I make sure that I got a full slide about confidentiality because it's a very crucial, important thing. So you tell the parents that, you tell the kids that, or the teen, the adolescent patient that you're gonna, again, you're gonna tell him at the beginning of the interview and before taking the drug and sexual history. It's a very important to refine that. Very important to remind the teen that, listen, again, all the information that you're gonna tell me is gonna be between me and you. There is nothing gonna be told to anyone. So all the information, as I mentioned, not to be to the parents unless let's say the patient say, oh, my parents knows everything about everything. At that time, you're gonna be okay. I'm gonna share the information with you. Otherwise, it's gonna be top confidential. So there are a lot of studies say, oh, you have a limit of confidentiality. Of course, the American Academy of Pediatrics and American Academy of Adolescent Medicine say you can breach the confidentiality. If you think there is going to be a homicide, suicide, or abusive behavior, you need to breach that confidentiality and go through authorities and whoever, if he needs help, suicide, you're gonna send him to this child psychiatry unit. Abusive behavior, you can tell the health, the authorities that about this kind of risk behavior. So that's the limit of your confidentiality. All the other information should be kept between you and your patients. Okay, so let's say with the home, I'm gonna give you, this is like the most important, most crucial question while you're asking the patient. So after you introduce yourself to the patient, after you gain, the parents leave the room and you ensure confidentiality, you're going to start with home. So basically there is no ما في ترتيب في الاشياء اللي حقولها. Whatever you think you go first, that's fine. I'm going with the heads, with the mnemonics, with the letters, but you can change the الترتيب whatever you think. When you ask about home, أول شيء حتسألوا who lives with you at home, where do you live, which district in Riyadh, and do you have your own room, do you live with your by yourself or you share room with your brother, whatever. بعدين السؤال الثاني to whom are you closest at home، مين أقرب شخص لك في البيت. ممكن أنا بحاول أترجمها بالعربي عشان ممكن we can talk to the parents, to the patient like that. هل في شخص قريب منك في البيت؟ إذا عندك مشكلة to whom can you talk at home، متى تتكلم، إذا عندك كانت مشاكل في البيت في أحد معين ممكن تتكلم معاه تأخذ نصائحه، شخص قريب منك. Is there anyone new at home، هل شخص سكن معاكم جديد، هل في مثلا name it relatives, friends, whoever، is there anybody new at home. هل شخص ترك البيت مثلا اخوه راح بعثه تزوج whatever، this can give you a more anxiety and more tension at home. Okay, the other actually it's for education and information. It's a very important question, a very important thing that all the teens, they spend half of their time, not now, I know now it's an online learning. I'm saying about in an ordinary situation, usually they spend 7 to 8 hours at school, which is not a short time of period, and they come home, they spend few hours and they go to sleep. So you need to know what's going on at school. What's your favorite subject at school? What's your least favorite subject? Some people say, oh, what's the benefit behind that question? You need to open up with the teenager. You need to gain trust. You need to chat to him and ask him. You can't go right away and like an investigator and ask him, did you do this or did you do that? Do you do this? No, it's like an art of talking to the teen. It's part of being there, feeling their problems and issues. How are your grades? there was any recent change in your grade, any dramatic change in the past. Did you get any dramatic change? A lot of depression, a lot of anxiety. Teens, they have like a sudden drops in their marks. So this is why they need to ask these questions. It's a good hint about suicide and depression, depression and anxiety question. The most important thing is, like, do you think your school is a safe place? Do you think that people at school, they treat you well? Do you feel someone like make you feel uncomfortable, unsafe? You need to know. We need to know about it. And the most important thing, like, when you chat with them, to ask about what you're going to do in your future. What's your future education? What's your goals in the future? Are you planning to study here or abroad? What kind of subject that you want to study at the university? Okay, eating. Again, you see, this is a very common, a very important thing. I saw a lot of kids with eating disorders. This is why anorexia, bulimia, name it, you can scream for it. What do you like and not like about your body? Are you satisfied with your body shape? Do you do a diet? Have you dieted in the last year? How often? If this guy is like concerning about their weight, let's say he's doing like a lot of dieting programs, and he's not losing weight, there's a problem. There's an issue with his body imaging. Have there been any recent change in your weight? A lot of depressive, anxious kids, they lose weight, or they gain a lot of weight. So it goes both ways. What do you think would be a healthy diet? It's a very important thing. What you need to ask the child what they understand about the healthy diet. How does it compare to your current eating patterns? Are you doing this kind of healthy diet, or you think that no, I'm still behind, I need to improve myself to eat more healthy food? Have you ever made yourself throw up on purpose to control your weight? Again, this is a very common behavior that teens do it, especially in girls. Bulimia, anorexia, they throw up to, and we see a lot of patients at this age. Activities. Again, what do you like to do for fun? What's your ايش الاشياء اللي تحب تسويها انت beside انك تدرس وتجلس مع اهلك؟ I'm sure a lot of teens, they have plenty of activities and fun things to do. So what do you do and your friends do for fun? And do you do anything fun with your family? Do you share with family any kind of activities, especially in the weekend? Do you do any sport or exercise? You have any hobbies? It's very important for teens, they have hobbies. Anyone in their life, they should have hobbies, and you need to ask about that hobbies and emphasize it. And if it's a good hobbies, that's a good thing to do in your life. How much TV do you watch in the week or in the day? And how about the video games? Video games, I think it's like a very, very, very important thing. I'm sure most of you, if you have a kid who's teenager, they spend half of their life in their school and the other half at playing with the video game. So you need to know what kind of video games, what are they sharing in the video game. There are a lot of hidden information that you'll be surprised, you'll be shocked actually when you find it and when you describe it. Sexuality, again, this is one of the resources. I got it from the American Academy of Pediatrics, American Academy of Adolescent Medicine. However, I know it's a very we have a very conservative environment. So I try to let's say change many of the question. But however, if you think this guy went through a difficult sexual behavior, you need to ask. So the most important thing is, have you ever been forced or pressured in doing something that you didn't want to? So that's a very, very clear question. Have ever someone touched you sexually in that the way you didn't like it? Okay. Have you ever been raped? I know it's a very shocking question, but you'll be surprised with the answers. Okay. Okay. The second S is the suicide and depression. very common, very important nowadays to screen for suicidal ideas and any kind of anxiety, depression thoughts. The most important is, do you feel sad or down more than usual? What do you think? If you feel like you are حزين أكثر مو قاعد you're not enjoying your life, that's one of the screening questions. Are you bored all the time? تحس نفسك طفشان مالك خلق ما أنت مستمتع بالأشياء اللي أنت كنت أول شيء تستمتع فيها. Again, it's one of the screening question for depression. Are you having trouble getting to sleep? Sometimes anxiety make you cannot go to sleep, have amnesia, or the other way around, you might sleep a lot. So this question goes both ways. Have you thought a lot about hurting yourself or someone else? Do you find yourself spending less and time with your friends? Again, this time in their life, spending time with friends, it's the majority, it's a normal thing. Parents should not be worried about it. However, if you think that the child, that the things that he do with his friend, he's not interested or she's not interested to do it anymore, that's a red flag. That's a red flag. This patient might, he might or she might be going in a depressive phase. So again, it's a very important question about time spending with the friends and fun things doing with friends. Safety. I mentioned the most common cause of mortality in this age is motor vehicle accident. There's a lot of studies show there's a lot of kids that drive under the drug influence. Yes, he might not ride, but he might be sitting or riding with, let's say, an older kids who's under drug influence. So alcohol, drugs. So always make sure that this child, this teen, adolescent patient wear a seat belt. Do you wear a safety equipment for sport and physical activity? Let's say a helmet for biking. It's a very important thing. That's to ask. Safety is one of the most important thing in this lecture. Most important thing, I can ask about any violence at your home. And I know that a lot of families, a lot of people, I don't know, especially boys, they fight, but I'm not sure if this is normal or not, but again, you need to ask. And I know that a lot of siblings, they fight the whole day and it goes physical, but I'm not sure if it's right or wrong, but you need to ask about it anyways. Okay, so I have this question, like few questions about how to talk to the teen about home. This is like give you a poor example, better example, and what's the reason. So let's say about home. You can go and open the door, and whenever you talk to the patient, you say, "Oh, tell me about your mom and dad." I'll tell you what. Like, what do you know about your my dad? Like, that's not a good question. It's a question that has like you're not expecting the child to say, "Oh, I love my mom, I love my dad, and they fight the whole day and night," but that's not the way of the asking question. The better version of that question: where do you live, as I mentioned, and who do you live with at home? Okay, so that's one of the things that you can minimize the diversity of the answers of the teen. Education. One of the poor tasks to ask: how are you doing in school? The better version is like, what are you good at school, and what it is hard for you? How is your grade? Is it getting better, or is still the same, or getting worse? Activities. One of the things they ask: do you have any activities outside the school? The better version is like, what do you like to do for fun, and what the things that you do with your friends? So it's more concise, more specific question to get you more answers. Drugs. Again, you can't go and like in the middle of nowhere and you tell do you do drugs? It's like being an investigator. The better way to explain to them, like, you're gonna tell them there are many young people there experiment with drugs, alcohol, or cigarette. Have you ever, you or your friend, tried them? And if he said yes, and then you can ask him. This is why one of the things you reassure the teens that, okay, it's not you. There are a lot of kids. There are a lot of people that يعني using drugs, smoking cigarettes. If you do that, that's fine, but you need to tell me which one and how often, and that give you more details, okay? Okay, before I wrap it up and talk about the HEEADSSS assessment, you need to, I have a few points to mention about the HEEADSSS assessment. You can't get everything at the first interview. It's almost impossible to know about the whole situation of your patient. This is why in the general pediatrics clinic and continuity clinic, more frequent visit give you more trust, build a better relation with your patient, open up, give you more information. No one is perfect, including the patient, the teen who, let's say, he's stressed out, he's anxious, he forgot to mention some items or question, which is fine. Like, you can't get everything. This is why it's not about you. It might be from the patient, because he came, it's a new environment. He came with his parents, or she came with her parents. She feels a little bit strange that to share everything with, let's say, her doctor, unless she knows the doctor and the parents know the doctor. That's the most important thing. We use the psychosocial screening, the HEEADSSS assessment, to generate a problem list. We're not expecting you to be an investigator to give me a report about this patient in 2 papers or to describe him. The most important thing as a general pediatrician, as a general pediatric resident, is to have a problem list with this guy. He has an issue with safety, he has an issue with, let's say, at home. This is why you need like 3-4 problem lists, emphasize the whole situation. If there is a crisis, immediate action should be taken. Let's say this guy is depressed, he wants to hurt himself, she wants to hurt her, she needs to be seen or admitted under psychiatry ward. If there is any problem with homicide, again, authorities should be told, and more action should be taken. Again, before, as I mentioned, I'm keep going back and forth about this thing. As a pediatrician, general pediatrics, as a resident, as let's say a family medicine, also, it's a very important thing for them, because they see the patient from 14 to 18. You need to explain that you're going to be asking personal question. Personal question means uncomfortable question. This is why you need to be confident and you assure confidentiality. You can't use why are you here. You need to ask more of, as I mentioned, you need to get more introduction to the patient. Let's say, I like your clothes today. You need to open up. Oh, you can mention, oh, the weather is so nice today. What do you think? So this at least give you a hint that this patient, the teenager, they can share with you their personal, sensitive information. You can't come and you say, oh, why are you here? What do you do for fun? It's not something to be memorizing. It's more something to be sharing and talking, discussing with your patients. Okay. One of the things that I always keep asking the doctor, resident, and my colleagues is like when to do the HEEADSSS assessment. If you go through the literature, there is no specific age. However, wherever you think this child exhibit early physical and psychological changes, I'm talking about secondary sexual characteristics in boys or girls, you can ask. However, to make it easy, I would say 10 years of age and above and older, I think it's reasonable. 10, 11 years of age is reasonable age to ask your patient. Okay, what time is it? I need to wrap it up. I have a few more slides, and I'm open to answer different questions, and if someone wants to عنده اقتراح أو أي شيء. Again, HEEADSSS assessment, I would say psychosocial assessment, is an essential part of your history while seeing an adolescent patient. It's like birth history, developmental history, vaccination history. If you have a child 10 years of age and older, you need to ask him about psychosocial history. HEEADSSS assessment, it's considered fine. The most important thing, and two words, like if you want to go out from my lecture having 2 words about my lecture, the most important thing is like to ensure safety. Safety should be your top priority. At home, at school, with the friends, the most important thing is to know about this patient. Is this patient safe at home, school, or not? Confidentiality. This is, I think, the 10th time I'm telling them, because I know how the parents act. I have few parents that they refuse, but they don't have the right to refuse interview their child or their teenager child, because it's one of the things that you need to do it while you're doing your history taking. You always go with open-end question more than an yes or no question. So you can say, are you doing drugs or no? Are you feeling depressed or no? No. You need to add. You need to give more introduction to your talk, as I mentioned, and then you give more open-ended question. However, you can't give. You can't say what do you do for fun and you stop. You know what I mean? Like, you need to be more concise to your open-end questions. Okay, so let's say at the end of the interview, at the end of the meeting, I ask the parents to come back. We talk about different issues. I do my physical exam. I think the most important thing is when you end with this patient, you need to have this like a weather report. A lot of people, especially in the US, they like this conclusion about the weather report. So what do you think about my child? You're gonna say, oh, he has a small things, like he's doing fine overall, and he has a few issues as any teenager. So I would say this is a sunny day with a few clouds, which is like fine. This child, he has a lot of risk behavioral things. He do let's say smoke cigarettes, do drugs, a lot of misbehavior with teens. I would say he's a very sunny guy, or it's like a very sunny weather with the high all the time. So this is like he has a high risk behavioral issues. On the other hand, if you have a patient, let's say depressed, in a low mood, and he's not enjoying his life, you're going to describe it as a cloudy with the rain likely. So there is no sun, there is no enjoying life in his situation, her situation. Please give your patient autonomy to express their feeling, and try to be a good listener. You can't interrupt patient, especially when they're sharing sensitive information, private information, and you interrupt them. Give them for full autonomy, full time, and make sure that you listen to them. Show them empathy, and also reassure that all the things is going to be held in between you and your patient, and you're going to find a solution to different problems if they have any. طيب. هذا السلايد الأخير للأمهات يعني زملائي اللي عندهم teenager kids. I'm talking about patient, but if you have, this is called a resilient teenager. When you think this your kid it's a resilient, it's he's a tough, he's a very good teenager. طيب أنا هعطي كم مثال إنه ايش الاشياء اللي ممكن اذا شفتها في طفلك، خاصه كثير انا اعرف منكم ابهات امهات، في بعضكم ما شاء الله لسه صغار، بس اللي عنده اطفال وفي مرحله المراهقه، هذه مرحله جدا متعبه للوالدين. فواحده من الاشياء اللي انا جبت سلايد هذا outside التوبيك بس to show you how we think about resilient teenager. طيب at home they are connected. Connected means they are talking nicely to the parents. They're caring to their parents and family member. They accept responsibility. It's a very important thing to give your teenager, to give your a child يعني more responsibility, and they accept it and they do it. Okay. He can take care of his siblings or her siblings. That's a very important thing. This is one of the things that we think this child is resilient. This is a very good teenager that he takes, let's say she takes care of her younger brother or sister. That's one of the things that makes her a good teenager. Education. So better than average in the school performance, feeling of connection to school. She likes to talk to her teachers. She likes to have fun at school. That's more give you a hint about connection, يعني meaning. She has strong participation in extracurricular school-related activities, let's say sports. For activities يعني الولد يكون أو المراهق يكون عنده leadership skills among his friends. Religious affairs, a very important thing. يعني هذا I'm sure a lot of you make you feel happy that if your child, your teenager يعني is يعني يصلي more يعني attached to the religion, to religious task. This is considered part of a resilient teenager. This is like an American or a North American journal. But again, see, one of the things that you need to be happy if your child is يعني praying and يصلي وما شاء الله يسوي فروض وكذا. هذا one of the things make him a better teenager, a better person in the future. Drugs, عنده والله يقول والله انا ممكن اصدقائي يشربوا كذا، لكن انا الحمد لله انا ابوي وامي قالوا لي انه هذا خطر عليك. ف this is he refused to participate. Suicidality again, اهم شيء انه ما في احد في الفاميلي عنده suicidal يعني family history that give him a higher risk to get a suicidal idea or يعني actions. He has successful coping skills. يعني successful coping skills. Whenever you give him a stressful, there is a stressful situation, he made it better for him. He of course يعني he get anxious, but it won't affect his life يعني severely. He get anxious for a few hours and then he became better. Safety again, يكون يعني يلبس حزام الأمان وما يدخل في ما يركب مع ناس مثلا ride with older kids that يفحطوا ولا يعني عندنا في السعودية هنا التفحيط is very important. It's a very يعني life threatening dangerous thing. So he refused to participate in that. يعني that's make him a resilient teenager. ف يعني في النهاية عشان أختم، أول شيء شكرا أنكم حضرتوا المحاضرة. أنا ما خليتها كثير يعني it's 45 minutes. The most important thing in this lecture is to give yourself time to know up يعني to practice about psychosocial history. You don't need to go in order like from the head. Whenever you can start, you can start. It give you a very important information about the whole family, about the school, about the friends, and the patient itself. Make sure that the more visits with the patients, you gain more trust. And unfortunately, احنا ما عندنا adolescent يعني specialist ولا adolescent medicine يعني تخصصنا، لأنه معظم الأطفال يتشافوا من 11 إلى 14 تقريبا. 14 هو أكبر عمر، بعد كده يتحولوا للفاميلي ميديسن. I'm hoping إن شاء الله in the future بإذن الله يعني one of the day that pediatrics should be until 18 years of age. I know that our friends in family medicine and in the medicine they're struggling with the teenager. And especially they don't know how to deal with them. I'm not criticizing them, but I think it's يعني fair for the patient to be seen until age of 18, and from a general pediatrician, adolescent medicine specialist, but they need to be seen and followed up until they are ready to go to finish their high school and go to university. Thank you so much. طيب أنا جاهز استقبال الأسئلة. اللي عنده أسئلة يشغل المايك توكل على الله.
السلام عليكم.
هلا دكتور بروف
المشكلة أبو أسيل إنه الأدولسنت ضايعين عندنا للأسف. يعني لا ترى لا يعني إحنا كثير من مرضانا نحولهم من عيادة للبرايمري كير للأدلت، صعب ما أحد يقبلهم. ما في عندنا أدولسنت ميديسن، لا عندنا في البيدياتريك ولا في في الادلت ميديسن للاسف ضايعين فعلا، مشكلتهم كبيره ترى. واظن واحد من الزملاء حاول قبل كم سنه يحل المشكله بايجاد adolescent يونت، adolescent medicine يونت، وما ما نجحت للاسف. ما ادري هل عندك ابديت او واحد عنده ابديت حل الموضوع؟
والله انا ما عندي ابديت، بس انا اقول يعني one of the things that I يعني انا سويت المحاضره هذه بس عشان اقول للناس انه ترى في تخصص اسمه adolescent medicine برا يسووه 3 سنوات، يعني زي الكارديولوجي، زي الجي اي، زي اي other subspecialty. يعني unfortunately I saw a lot of kids 15, 16 years of age with eating disorder habits, seeing in the family medicine, internal medicine. They went home, they discharged, they don't know how to deal with them. يعني unfortunately we need يعني I'm not sure what to do, like maybe إن شاء الله يعني ممكن we raise it up with دكتور خالد إنه يعني يكون عندنا مثلا عيادة مثلا adolescent medicine، بس again we don't have the يعني a specialist يعني unless if someone يعني are interested or and it's very difficult if you're not trained. الشيء الثاني العمر حتى للأطفال to be seen يعني إلى عمر 18 I think it's fair for us and for them يعني even for the family. يعني you can take the kids from يعني عمره 15 سنة to I would say adult doctor. يعني adult doctor usually يعني they treat their patient differently than pediatrician do يعني.
مهدي السلام عليكم. الو مهدي
اتفضل.
اسف ان كان thank you very much. I enjoy the talk. تمام. انا اعتقد انه one important issue is قبل ما انه نطالب انه we have to look for adolescent, we have to be ready, we have to have a base. I guess زي ما تفضلت انه we have to discuss مع ال head of department انه يعني إن لازم نشجع ال demonstrator or whoever gonna join us in pediatrics إنه we have only this slot, because you cannot recruit adolescents, okay, and you don't have an expertise around to deal with their problem. So I guess this is very important that we get out of your lecture is to probably نتكلم مع الرئيس إنه ونحتاج إننا نشجع الزملاء على يعني التخصص في هذا الادوليسنت ميديسن، because زي ما تفضلت يعني هو يعني عباره عن علم موجود internationally لكن للاسف is not practiced عندنا، لانه زي ما قال البروف العايد ضايعين. وبعدين احنا يعني بطبيعتنا احنا we are over protecting التينيجر. السؤال اللي كنت بسألك قضية التنمر عندنا is it exaggerated ولا يعني ما يعني كذا؟ هذا سؤال قلت كذا أعطيك إياه.
يعني أنا شوف أنا اللي قريته من في لا ما is not I think it's يعني is undercovered يعني التنمر. بس هو شوف يعني أنا أتوقع يعني أنت لما تقرأ مجلة بروف في مثلا نورث أمريكا ولا في أوروبا الculture is different than here يعني. فهناك يعني one word make it a big deal ولا one thing. هنا ممكن يعني أنا أتوقع إنه it's very common to see إنه في يكون تنمر يعني bullying is very very common here. بس مشكلته إنه الآن في يعني a lot of studies saying that it might cause يعني direct issue to the patient, to the teens يعني especially let's say مثلا عندك واحدة patient مثلا نقول مليانة ما شاء الله يعني مستصحة، ولا ولد مثلا مليان سمين، فأقل شيء بيقولوا له يعني كلمة إنك أنت يا دبة ولا يا سمين. يعني هذه الأشياء make him feel bad about himself. And if there is like a family history of depression, if there is a bad يعني base زي ما تقول أنت في البيت ولا ما في أحد يعني someone supporting him from his family member, he might get to يعني depression very easily. بالعكس أنا ما أشوفه exaggerate، بالعكس is a very important thing. يعني we see a lot of cases يعني بس عشان يعني يتأثر بكلمة ولا يتأثر بفعل من خاصة من البيرز. يعني أتكلم على السيم ليفل، ممكن يكون اللي أكبر منه يعني في نفس المدرسة، لكن الكلمه لما تجي من زملائه ولا من اصدقائه يعني make a huge impact especially at teenager. يعني انت تعرف انت في العمر هذا صديقه يقول له نصيحه ياخذها، الوالدين ولا however يعني في الفاميلي member told him most of the time يعني he will يعني criticize and not take it. لا بالعكس انا اشوف it's there but there is more awareness about it.
Okay. Can I interrupt, Dr. Mahdi? Thank you so much for the presentation. I just have 2 comments. My first comment is about how to solve the problem of not covering adolescents in our hospital. And I think if I'm not mistaken, the real problem is that our pediatrics ward is mixed between boys and girls. And extending the age beyond 14 years of age is not acceptable in their culture, as well as not acceptable in the hospital culture as well. So I think the main thing the way around it to extend the age group where we cover our pediatrics population, I think we need to develop a new ward with a single rooms, so that if a teenager is like 15 years old, a 16-year-old who's a boy can be admitted to a single bedroom, so that they don't get exposed or they don't expose other females in the ward to them. I don't think we need a special. Yes, for sure, adolescent medicine is a specialty, and we should consider having a specialist in adolescent medicine in our hospital. But again, like this is something that we are trained to deal with and to interview during our residencies. Adolescent medicine was an important part in our training. So every pediatrician should be, when they're graduated from their residency, should know how to deal with an adolescent patient. For the second part, التنمر, it is a reality. It is a problem in our society. People underestimate its effects, but like even for myself, remembering my school days, there was a lot of bullying, and it's not necessarily coming from people who are older. It comes from people from students from the same age group. And if you go to one of the schools, you'll find, and you hear it. I hear it from my nephews, from my nieces, that there are clusters of people. So there are groups of people. This is a group of people who are like wannabes, and that this group of students are the students اللي هم يعني
دوافير.
كل أحد يعرفهم. So it's there, it's here. I'm sure it has a lot of significant effects on teenager lives and later on in their adult lives. We are underestimating this issue, but it is a real problem, and we're going to see manifestations of it. We keep seeing manifestations of it, and we will continue seeing manifestations of it unless we realize that this is a problem and it needs to be worked on. I think العنصرية starts from the beginning, starts from the teenage years. So unless we can stop it from these years, it will not stop in our country, and we'll continue to have this problem in our community. We have to try and build a community that is based on acceptance. Everyone should accept the person in front of them, accept what their background, and their color, and all of that. We think that we are شعب مختار, and nobody, we don't do that. We don't discriminate, but there's a lot of discrimination, either color-wise or background-wise. It's under the covers, as you say, but it is there. It is a problem. Thank you. Sorry, طولت عليكم.
Sure, thank you.
السلام عليكم.
تفضلي.
Thank you, Dr. Mahdi, for this valuable lecture. I have a comment and a question for you. My comment is about the bullying which is really, it's a major problem here, and it's rising in our society. I would just want to draw your attentions as a colleague for the cyberbullying, which is really rising in these days, and with the allowance of our kids to be online most of their times. Even the school programs, they have a chatting, and during the classes, I have a comment from parents and some of them my patients, and some are relatives. There is kids are exposed to cyberbullying rising nowadays. I mean, even within the official applications for learning and education, which we are allowing them to go through, and add on it the other applications and games. This is, I think, it's there. It's rising in our society, and it's need
awareness,
orientation for the kids themselves to speak about it, and for the parent and healthcare worker to work for it. My question is for the assessment of adolescent. Sometimes it's when you are trying to build a confidentiality, and then you have to break it because you find something need intervention. Mainly the most things we are facing is the eating disorders, let's say. So what is the better step to take it? I mean, to allow for intervention without breaking the confidentiality and the trust you are built already between you and the adolescent.
Okay.
You find him having, let's say, signs and symptoms of anorexia nervosa. We have to act, we have to refer, and then, I mean, is it appropriate to take permission first from the adolescent himself that I'm going to talk about this issue with your parent, with other specialists, or just to try to do the things behind his knowledge? What is the best way from you?
No, I think,
thank you.
You treat adolescent like, and I would say, as an adult in this situation, you need to, once you get the feedback from him that let's say there's an eating issue, as a general pediatrician, you should have like the minimum amount of knowledge is how to screen it, and then you arrange. Of course, you're going to always ask for specialists, but you can't hide it. You need to tell him, and this patient needs to seek more help, because eating disorders down the road, if it's not solved, he's going to be in the hospital, admitted, whatever, with arrhythmia, bradycardia, electrolyte imbalance. So you need to refer him to, let's say, child psychiatrist. And this is the most important thing, is like adolescent, زي ما قال البروفيسور دامل، زي ما قالت الدكتورة لنا، إنه whenever you get this program, structure program, you need to have an access to different subspecialty, different categories, such as the adolescent. One of the things is like you in this our situation, we are a general pediatrician. We don't have that much information about eating, but we can always refer them to a child adolescent. Yes, we tell the parents. I think I know you're going to tell me this is a breach of confidentiality, but you can't, unfortunately, you can't send the patient to other subspecialty because he want to, you need the permission from the parents, because legally he's still 18 years of age. You need to refer him to child psychiatrist or whatever subspecialty he wants.
Dr. Mahdi, if you don't mind me replying to that question, adolescent medicine has a special place in my heart. I think, as you mentioned in your presentation, it is really important to talk to the teenager about when are you going to breach this confidentiality. And one of the reasons why you would breach the confidentiality is if the patient is harming himself, or there is a safety issue. When you're talking about anorexia, there is harm that is happening to this teenager. So you're really not, you've prepared them to include someone else in their care. and to breach this confidentiality to the parents so that the teenager can get help. So I think it's at the end, it's if you start it right and you do your confidentiality very well, very clearly with the adolescent, then you can explain to them that you are worried for their health and that we need to involve your parents so that you can get better health. And I've never had a problem with a teenager where they refused to involve the parents in their care.
طيب الوقت شكله انتهى، بس انه انا اتوقع في واحده من الجراند راوند حيكون في الدكتور، انا this I don't know if I'm right or wrong، دكتور سعود العمر. I think he's a adolescent specialist. I think so. I'm not sure, but يعني I'm reading the whole committee. I think we need يعني someone who's more specialized than me يعني to talk about يعني especially أنا ما أعرف المشاكل كثيرة هنا في التينيجر في السعودية، لكن أتوقع إنه we need more يعني زي ما قال بروف زامل more structure program، إنه يكون في يعني at least if we have an expert coming once a week, once يعني every 2 weeks and meet with the patient. We have this يعني I don't say locum or يعني part-time specialist that at least when our resident or me just like go and learn from him and what's the art of dealing with the adolescent patients. يعطيكم العافية جميعا، وأنا آسف إنه يعني خلاص الوقت انتهى عندي، وجزاكم الله خير. Thank you for attending the lecture. I hope يعني you like it and أتوقع حينزل في it's gonna be recorded on YouTube إن شاء الله in our Department of Pediatrics YouTube إن شاء الله. شكرا جميعا.
شكرا أبو أسيل. شكرا. لا زلت على الخط